Good afternoon, everybody. I'm Matt Harrington with the Southwestern Vermont Chamber of Commerce. I want to thank you again for joining us today, as we've done all year long, ever since COVID-19 has hit Vermont and the world. We've tried to broadcast information that we thought was important to the community of Southwestern Vermont. So for those of you joining us on Facebook Live, thank you so much for taking some time out of your busy day to do that. This will also be on Cat TV as well. If you are watching on Facebook Live, please leave us a question. We're going to go over a lot of questions with our two guests today. There's a lot to cover, but if there's something that you really wanted somebody local to answer, let us answer that as well for you. I want to thank Cat TV and Mike Cutler, who's the producer of this content. Thank you so much for broadcasting live. They do a terrific job over at Cat TV, and the ability for us not only to meet with our two guests, but to be able to broadcast that live and then record it, and you can review it later as well. So thank you, Cat TV, for that. I'm going to jump right into some of our questions. I do want to introduce our two guests today with Southwestern Vermont Medical Center. Many of you are familiar now with Dr. Dobson, but I just want to thank Dr. Trey Dobson, Chief Medical Officer with SVMC, for joining us today, as well as Dr. Marie George, Infection Disease Specialist with Southwestern Vermont Medical. Thank you both for taking some time out of your day. I know you guys are. Thank you.
Yeah.
Great to be here.
Nice to be here. Thank you.
Great, thank you. And again, for those joining us on Facebook, please start to have your questions ready. We're going to monitor. But I do have some questions. Obviously, Dr. Dobson, right before we hopped on live, we thought we might get maybe a little bit bigger audience today, maybe for the sheer fact that vaccine looks like it's on the way, if not already here. And so we want to spend a lot of our time today talking about what does that actually mean for Southwestern Vermont and for the global community as well. There's a lot of that discussion. Talk to us first, though, about testing. Obviously, there's still a lot of concern. Nobody's really gotten the vaccine yet. So the idea that we still have to test, sorry about that, everybody. Talk to us a little bit about testing. Where can we get tested? What should we be testing for? What has kind of been updated in the last month?
Well, Marie, why don't you start off with that, and then I'll kind of go into the specifics of some of the locations. But Marie, is daily working on ensuring that we're doing the right testing and the best testing and enough testing, which is what she'll talk about.
Thanks, Trey. I think that testing, there's been so much excitement about vaccine that testing has taken a little bit of a back seat, but it's at really the wrong time. We should be testing actually more than ever, mostly because there's been such a big uptick in cases, both in Vermont and everywhere else in the US. Testing is a very important tool for us. It is our way that we are most effectively able to contain infections. So it is, right now people are testing when they travel, or if they've been exposed, or perhaps they have symptoms, but in fact, we should have a very low threshold to test. We have this additional ways now to test very easily and very cost effectively. And we'll put up a slide in a minute that shows you how to easily get a test in our community, which is really very exciting. Trey will go into some of the newer modalities for testing as well that we both have in the hospital and that we may be looking forward to even in our homes. But right now, testing should be done if you have any symptoms that might suggest COVID-19. So the typical symptoms that we've talked about and everybody has heard, which is cough and fever and shortness of breath, certainly. But we're seeing people with early infection that have sinus trouble, red eyes. They may have a nausea, vomiting illness, followed by feeling very fatigued and short of breath. Those are all overlap with COVID-19 possible symptoms. They're not in every case, but you should have, as I said, a low threshold, meaning go ahead and get tested. You certainly should also be tested if you are gathering with people that are outside your household that the governor's told us over and over we should avoid doing. If that happens, especially if you're not masked or distanced, you should test. If you're exposed to someone who has had the infection, and you should definitely test. You should test when you find out. And in fact, the state has told us when you find out, and then again at day 7 after your exposure. And in between, you should quarantine. So the message is to test and not to hold back on testing. And then Trey, you want to talk a little bit more about what we have ahead with testing?
Sure.
It's really exciting.
Yeah, so just to echo Marie, it is incredibly important. I can tell you, I'm a little bit down because, Matt, when you and I started talking back in June and July, I thought for sure by now that the world would be, or at least the country would be able to get quick, inexpensive and accurate tests. And they just, unfortunately, haven't materialized. A lot of promise, a lot of advancement, and we will see them, but they're not here right now, and we need them. But we are, and we have expanded testing locally to a significant amount. And that's what Marie was talking about. When I say we, by the way, I'm talking about SVMC, I'm talking about the state, I'm talking about collaboration with groups out of Boston, with Bennington Rescue Squad. So it's truly a multi-organizational effort that we all happen to be involved in. I'm just going to pull up real quick this slide just to show for our viewers. These are the 2 local testing sites that we have. These are both in Bennington at SVMC, the drive-through, which we've had operationalized since April, as well as a new one known as CIC, which is the organization that is helping operationalize the clinic. This is at the Bennington Rescue Squad. And in both places, you can get what's called anterior nair testing now. So it's a little bit less invasive than the nasopharyngeal. And we get the results back within 48 hours, often within 24 hours. It depends on the volume of tests coming in. I'm actually going to pull this off now because this is available on our website. And when there are changes, when there are updates, if there's a 3rd and 4th site, we'll be putting those up there.
Great. Thank you, both of the doctors. And I feel like I might have tested out every way you can be tested for corona. I think I've done it 2 or 3 times now on different times. Every time you go in, it seems like it's something different. It's always an exciting adventure. But absolutely, to Dr. George's point, test, test, test. Let's continue to test. And to that end, we've just gotten over the concern that was Thanksgiving. I think both of you would say we're probably not out of the woods yet with just the holiday feeling. Obviously, kids coming home from college break with Christmas and the holidays and the Jewish holiday starting. Where are we at with the impact that Thanksgiving had or didn't have in Vermont? What does that mean? How do we still need to be cautious when we look at gatherings during the holiday season, probably right up into New Year's Day?
Sure, I can start off here, then Marie can chime in. I will say that that the bulk of the cases that lead to significant illness and death are occurring in skilled nursing facilities and in care homes, but the bulk of the cases that are in the community that are causing illness, causing people to lose work, causing the schools to open and close, these are from family spread and spread from small social gatherings. And one source of that are the college age kids coming back and coming into the home. And so it's very important during those first 7 days, Marie and I talk about this all the time, is to test them right away when they come back, and then test them again after 7 days. And in the interim there, they should be quarantining. And then when we're doing family get-togethers, this is unfortunately not the year to have extended family get-togethers. It's very hard for people. It's very hard for me. It's very hard for you, but we have to do it right now while we're in a pandemic. And when we don't do it, that's when we see the cases. We can attribute probably 80% of our cases to family spread or spread from small social gatherings. And frankly, that's why the governor keeps harping on that, and the commissioner of health. It's not a popular statement, but we've got to do it until we can get to, which we're going to talk about soon, this summer and get through some of our vaccination and herd immunity, and we can start doing these things again. The problem is if we just stop and we start doing these gatherings, our numbers are increasing rapidly right now, and that will just continue that trajectory. But one more point on your question, Matt. We have seen increased cases due to vacation, due to the Thanksgiving. Fortunately, Vermont is seeing less of a bump than some parts of the country, and it's because everyone is so good at following what we know we need to do.
Okay. Dr. George?
Completely agree. And I do want to, give a shout out to Vermonters that have taken this very seriously and have, we have a state that takes care of each other. And I'm proud of that. It's very hard. We are all having a hard time. But the end may be in sight. Vaccine is coming. It is not a time for us to let down our guard. Our hospital does have the capability of taking care of our community right now, but it is a very short distance between a overwrought hospital, a hospital that cannot take care of everyone that is hospitalized or seriously ill, and what we're experiencing now. So I would, stress again that not to gather outside your household as much as we can, and to follow those guidelines for students coming home for holidays.
Well, Dr. George, you said the special 7-letter word, so why don't we hop right into it? I'm sure many people watching are excited, elated, maybe some caution around the vaccine. Let's spend some time talking about that. So if approved today by the FDA, when would the state of Vermont get the vaccine? When would it distribute it? And then we can kind of talk about how will it be distributed.
So it is very exciting. And people have heard us say this at other webinars that, in fact, the federal government has been distributing vaccine to the states even before there has been emergency authorization. The Pfizer vaccine, we expect will be approved today, and the Moderna vaccine perhaps in a week or so. We are ready to receive vaccine locally, and we've been in conversation with the state and for weeks. We expect that our vaccine will come within a few days of the release from the federal government, and it will. Right now, it's been a smooth process. We have the freezers that we need. We're creating a priority list that Trey will show you on a slide that will encompass our community, and will distribute vaccine with the prioritization and the ethical tenets of maximal benefit, minimal harm, and with justice and equality. So
I think can we, Dr. Dobson, if you're ready, let's look at that slide and let's talk. I know there are questions on Facebook right now as we put that slide up about who gets what and how do they get it and that sort of thing. So
sure. So I'm going to pull this up here. Let me get my see if I can get it to advance. Okay, so I'm going to start. This isn't the whole slide. I've got it kind of seriesed in. But before I begin this, let me just point out something. Marie did such an eloquent job of explaining how we've been planning, and we have been planning. There's an incredible amount of angst around vaccination, not the choice of whether or not to vaccinate. That's another separate thing. And we're here to tell you vaccine is safe. We'll tell you this again at the end. It's certainly so much more safe than any type of COVID disease that someone could have. And we'll talk about that at the end. I'm talking about the angst of this prioritization. We have to allocate and prioritize because we're going to get small amounts of vaccine to start. If we had tremendously big numbers of vaccine, we wouldn't have to do this. But it's going to go relatively fast. And so I say this out loud to people to help a little bit with their angst. Yes, we don't want to wait 4, 5, and 6 months. Some people will need to wait, but we're going to get it out fairly fast. And there's a lot of indication federally and at our state level that we'll be able to do that. So let's look at these phases. Depending on what source you refer to, there's 3 or 4 phases. I like the 3 phase because it's just more simple. You can see that phase 1 is a lot of people in the United States. In fact, this is about 130 million people in the United States, a third in this phase 1. And they include healthcare workers, so nurses and doctors in the emergency department, imaging techs, people that are in practices in the community, dentists. These all fall into this phase 1. And then it also includes certain service industries like police, EMS, firefighters, and then even essential workers with a very long list. I only did a partial list here, but it includes teachers, those that work with food services, transportation. So it's a big group of people. And then it also includes adults that have high-risk medical conditions, which is what we know. Those are the groups that are actually the most affected by this virus, and adults 65 or older. I'm just going to move through this real quickly, and we can do this. Phase 1 is anticipated to go somewhere from about now or a couple of weeks from now, as Marie said, throughout March and into April. Now understand that this, if you see in the upper right-hand corner, it says, or upper left-hand corner, it says subject to revision. This is a pretty understood time frame, both at the federal level and at the state level. But of course, the endpoints here can vary a bit. If we go to phase 2, this mostly encompasses those under 65, because they're going to be in phase 1, but that are high risk because of their living conditions. They live in group homes, they live in group settings. And that is anticipated to take a couple of months. And then at some point, pretty quickly in the spring, we should start with the general public. And the general public are the rest of the folks. This does include young people. The question on whether it includes children is not apparent yet because the trials are ongoing. And so I don't want to say too much about that other than we anticipate children will be able to be vaccinated starting in the late spring or summer, but we need to get some more trials going to look at the safety profile on there. By the way, we can say we anticipate because we don't anticipate any difficulty with the vaccine with children, but of course are going to be super safe on that. And then I'm just going to show one more real quick. This just kind of breaks it up. Sorry, Matt, just real quick so that people can see it. The reason that I wanted to bring this out, and again, Marie and I were talking about this morning, and the reason to show this slide, although it looks very similar to the other one, it's just phase 1. We want to point out that there is overlap. There's going to be some blurry lines here, and that's okay. It's okay to start one group, and if we see another group is ready to go, and the first group is still getting finished, there's going to be some overlap. That's going to occur everywhere. But we are going to prioritize. We're going to make sure that we prioritize groups based on, as Marie said, their risk of not only getting the disease, but their risk of transmitting the disease, and then their risk of a severe medical illness with the disease.
Great. Yeah, and I wanted to go right into, we had a couple questions. I know one we've kind of posed already before the meeting, but one on Facebook as well, and that has to do with type 1 diabetes, as well as the chemo patients as well.
Well, those folks would definitely fall into the phase 1, high risk patients. Those patients are going to be identified both within our medical system by their primary care physicians. There's going to be a way of clearly finding those folks within our community and encouraging them to get vaccinated. So absolutely, those are, some of the risk factors that will make a person at risk for severe illness, and we want them immunized as soon as possible. There are other underlying health conditions that put people at increased risk, including heart disease and underlying lung disease, as you say, many kinds of cancer, and those and autoimmune diseases, people that are taking biologic agents. So all of them, we are going to be working closely with physicians because they are going to be able to tell us who, from their practices should get vaccine. Patients that do not have physicians, we're going to have a plan for them as well. We intend to take care of the whole community.
And to go into those next questions, Matt, what Marie and I, and not just us, many people are working hard. I wish I could say everybody's name on this, both at the local level, but then even at the state level. So lots of good work going on, lots of sleepless nights to get this going. I will say some of the questions I know that are coming up have to do with the operations aspect. So Marie and I can talk about the different groups that are getting vaccinated, but she sort of started in when she said that the physicians are going to let us know who to vaccinate. It is likely that the way this is going to start is vaccination at the hospital through a drive-through clinic, just like we did with influenza back in October, just like we're doing now with testing. And in fact, the testing and the vaccination will probably be through the same system, same line there. So I'm going to turn getting a call there. So the way that it'll work is certain groups will say this on our website, we'll say it in the media, we'll be able to come to the hospital, they'll be able to get in line, they'll go through, we'll do some verification, some consent, we'll do the vaccination, there'll be a period of time, likely about 30 minutes, that they'll need to be observed, and then off they go. I know it's anxiety provoking, but it really will be straightforward, just like the influenza one was.
Yeah, and I did that one as well, and that was terrifically well done. You guys have done a terrific job up on the hill and all throughout your various satellite operations to make this as quite effortless as possible on public part. So thank you.
Thank you,
Dr. George.
I just wanted to say and add that, as we're formulating these plans, patients that are admitted to the hospital will also be captured. And we expect that within some weeks to months that physician offices may get supply, pharmacies are going to get supply. We know that nursing homes and other care homes are going to be getting a supply, and there's actually a separate track, which I think is sort of brilliant, to make sure that those very high risk areas are cared for directly. So there are plans running in tandem for different risk groups, and we do intend to make this as mainstream as we can as we get more and more vaccine. Right now we have to prioritize because we're not getting the full amount for everyone in the community, but we're very optimistic.
Great. So talk to us. I think the other really big question is immunization and how long that actually takes for that to happen. Dr. Dobson, we've talked often about herd immunity and the fact that even a really strong vaccine like we seem like we're going to be having with 90% or above efficacy is a really great way to increase herd immunity. But I think everybody's basic question on the mind is, okay, we move these people through the spring, everybody gets their shots. Are we safe in June? Are we safe in July? Are we safe in 2021, 2022? What does it take?
Matt, you asked about 15 questions there.
I did, but boil it all down to the right answer, doctor.
All right. Marie, you want to start off with some
No, you go ahead. Go ahead.
Okay. Well, let's see if I can go backwards. 95% efficacy is really good. It's not exactly saying that it's 95% gonna prevent the virus. It's a comparison between the groups that received a placebo in the trial and how many of them got COVID-19 versus those that got vaccinated. But you can read through all the details and the differences there. Just know that's a highly efficacious, highly probably effective a vaccine. So that's a good start. However, if we are continuing to spread the virus among each other because we're not distancing and we're not wearing masks, the burden on society will actually increase. It's paradoxical. If we had a vaccine that was 60% effective, but we adhered to mask wearing and distancing until we got to herd immunity, it would be more effective than a 95% efficacy vaccine that we're not paying attention. I tell you, Matt, I'm afraid, and I know Marie and I talk about this all the time, that people are just going to stop their mask wearing. They're going to start gathering in large groups and start traveling too soon. And that's just going to increase the burden on society. We want our hospitals to stay open. We want our schools to stay open. We want people to be at work and not be sick. So the way to do that is to celebrate that we have a highly efficacious vaccine, but let's get through the spring. Let's just keep doing this until we can get into the summer. And at that point, people will quickly revert. So you can't slowly revert. People will quickly revert, and we'll be in a much better place. I believe that Vermont will do that. I'm not so confident about certain other parts of the country that we're watching on TV right now with their protests on mask wearing, and I feel for those societies.
Yeah, that's great, Trey. I just want to reiterate and stress that this is not the immediate fix. And some of that has to do with both people are going to be immunized in waves, and there are going to be very susceptible people that are not going to receive vaccine until quite late. The second thing is that you do need 2 vaccinations for these 2 products. And in fact, there was a federal testimony done yesterday that talked about timing. And in fact, after the first vaccine of both Pfizer and probably Moderna, there is less than a 50% protection, and that the booster is so important. So we're talking about everybody being committed to a full month, between, in 21 days, 28 days, a month or so, but, before you can really think that you have vaccination on board. And that's very, very important. Just something for us, the vaccinators, and for probably the public wants to know that 21 days and 28 days, fortunately, are not in stone, even though we don't want people to delay it a lot. That the testimony yesterday confirmed to us that there is some leeway, so we will get everybody their second dose. But you don't necessarily have to make your day clear on 21 days, although that would be good if you want.
I think a majority of people will probably follow exactly what you tell them to do if they're receiving the vaccine. A couple questions on Facebook before we kind of move off the topic of completely the vaccine. One, what is the vaccination priority for a multi-generational household with elderly members at very high risk? Should they all be getting it? Will that one person at high risk? How does that work? Have we figured that out?
Well, currently it is the person at high risk in the household that will get the vaccine, and that's based on the tenets of that the most risk people will get vaccine first. Clearly, it is, if a household has healthy people and not as healthy people in it, your responsibility is that we can vaccinate the least healthy person that falls into the category. Your responsibility is to keep yourself and them safe like you've been doing. So there wouldn't be an entire household at once, no.
Okay. Some other interesting ones, and I think I might know how you two might answer this, but we wanna make sure that we're answering questions from the community. The people with O positive blood have a lower chance of getting the virus. Any evidence to that?
Just briefly, there are some slight differences when we look at blood groups, and they are statistically significant, which is interesting. There's also differences between men and women. There's been differences between hospitalization, and these are not large enough to really guide any change with decisions like vaccination, and certainly not with mitigation measures. I think it is good to know that those are those differences and to keep looking at them from a scientific perspective and future medical planning, but they really are not that relevant to anything we're going to be doing in the next 12 months.
Okay. And then one more on Facebook, and we'll move over to some of our other ones. But in terms of asymptomatic people, obviously we've seen some news coming out of the UK in terms of people with asthma and how it's impacted them. What should our audience be aware of? What's the level of concern that both of you have on that?
So you're talking about getting vaccination, is that right?
Yes, let's go
Yes.
there. There was an earlier question about asymptomatic people getting tested. So maybe we'll start with tested and then move to the vaccination. Any data around that? Any research around that?
Yeah, there's a lot of data. Asymptomatic people can be effective transmitters of the virus. So we do, still recommend that if you're exposed and asymptomatic, that you would be a person that should be tested. As you know, we're trying to stress here and for here on out that testing is a great idea. Is the accuracy of the tests in asymptomatics as optimal as it is in symptomatics? No. However, in large populations, that is somewhat it's not as important, because we do want to find any cases that could potentially transmit to someone else. So, there is routine testing going on of asymptomatic healthcare workers in the nursing homes and in clinics. And that is a screening process that's quite helpful. It's, those pre-symptomatic people that are asymptomatic on day 1 and 2 are really effective at transmitting virus. And then when they become symptomatic, they become even more infectious. But those couple of days before you have symptoms are really important. So yeah.
Great. And I think I blended two questions. So let me hop over to my second part of the question, which has more to do with the vaccine. We saw coming out of the news in the UK around allergies or EpiPens being of concern with people. So so what is the concern? What I guess when I was seeing that, I didn't dig too deep into it. I didn't know if 2 people was a big deal, or a little bit. Was the news big deal, or was it, out of all the people, some with allergies had trouble with it or challenge with it? I'm assuming that's why you're also keeping them 30 minutes after being vaccinated to keep an eye on them and their allergic reaction. So let's kind of pivot to that question. In terms of allergies, people with a lot of allergies, do they have any concern around the vaccine? Should they not get it? What does that look like?
Sure, I'll start. Marie, you can jump right in there. So first off, the reactions were real. There were 2 people that had serious reactions to the vaccine. And then second, it is expected. In other words, in the numbers of people that we are vaccinating there, it is expected that a certain number will develop a reaction that is more than just a mild reaction. Now, I do want to compare that. These are the risk things, Matt, that you and I were talking about back in June. If you look at things like the numbers of people that have a reaction just in the United States to a severe reaction during the day to different things, whether it's a bee sting or tree pollen or something, they do occur in small numbers. They occur, and the same thing's going to happen with vaccine. That doesn't mean that we ignore it. In fact, we watch it very carefully. We study it. And right now, what Great Britain did is they said, look, we had these 2 cases, 2's not very many, but we're going to hold off on people if they've had severe reactions in the past, so severe that they have to carry an EpiPen. Let's hold off and let's look at these 2 cases. It is likely that they'll go ahead and restart vaccinating those folks, knowing that it's still going to be a small number. By the way, the risk of vaccination and having one of these is so tiny compared to the risk of getting COVID-19 or spreading it to a family member and having that family member wind up in the hospital. So it's a small risk. It's in the media because it happened and we need to pay attention to it. But at this point, we don't anticipate it changing any of our vaccine schedules. And that's why you saw some news, but not much news on it. Great.
Dr. George, and please weigh in, Dr. Dobson. I just want to take a moment and say, how miraculous is this? I mean, on the scale of everything that you've seen in your career, to have moved as fast as we did, to be as as safe as this vaccine seems to be, what have we done in the past with flu? How long did it take to get, polio? Are we really at kind of this groundbreaking moment in terms of, did we really show kind of a real strength of coming together, focusing on one problem and working across what it seems to be departments, governments, countries to find a solution? Are you guys kind of celebrating that at this moment? Obviously, quite cautiously, but talk to us in terms of your backgrounds. How big a deal is this?
Well, it's a huge deal. I've had, God, I'm getting emotional about this deal. I've had the opportunity in my career to both see how HIV has been treated with the coming together of multiple minds, multiple governments, multiple laboratories, and have created medications for HIV that have allowed people to resume normal lives. And I never thought it would happen again. You didn't expect this this.
Well, I mean, I think we're all at the end of a long year.
We are.
So, especially you two.
The vaccine is miraculous. The mRNA vaccine technology is new, but as an esteemed colleague said, it has been 17 years in the making for using RNA technology. And in fact, some of this came out of the HIV world. So it's sort of an interesting melding of infectious disease, moments. So these two new vaccines do use amazing technology that is not science fiction. It has been well studied and it has had a progress over time in order to bring us to this place. It has been collaboration between countries. It's a wonderful message about what we can do when we do come together. As Trey was talking about, the efficacy, the amount of immune response that we're getting with these first two vaccines is so encouraging. It's something of dreams, that we could actually have a robust antibody response in actually right across all ages. So all of these things, align with the tenets of infectious disease and the, vaccinology and, just all of the goals that we need. And thus far, the safety looks quite good. So we, and as we've been doing the measuring risk and benefit, the benefit is so outweighed. It's just is the thing that we all should be committed to. I'm really excited about this moment, and as long as everybody continues to do what we've been doing as Vermonters, we will, we'll get there.
Great. Dr. Dobson, anything to add?
No, I can't follow that. Let me just say, I think my grandkids are going to have American history book, and the first half is going to be the praising the collegiality, the camaraderie, the coming together that you mentioned between government, non-government, the private sectors to develop and follow science and develop a great vaccine. Unfortunately, the second chapter, the second section is going to be a learning for the new generations and how not to be so divided socially and from a political aspect. And it's going to be both studied within countries and then among the world. And we've got a lot of lessons to learn. It's brought out some ugliness that continues right today, as I was looking in the media. And I hope we can get past that this summer, just as we get past some of the deaths and economic downturn from the virus.
Yes, absolutely. I'm sure we talked a little bit about this before, Dr. Dobson. Continue to wear the mask, you'll get vaccinated. Is there a point when and maybe the most basic way to say it is there a point when we don't wear masks anymore, or what I think a lot of people are thinking about, getting back to normal? And we've talked at length on this, on these telecasts, about the new normal versus ever getting back to what was before COVID. So again,
Right.
kind of a loaded question with a bunch of other questions. Is there ever a time we don't wear masks? Is there ever a time we get back to normal?
Yeah, there is. There really is. It's a little bit of crystal ball, and whereas Marie and I are going to agree on this, there might be somebody else with a little different time frame. But in the end, all pandemics end. There's been a lot of pandemics, not in our lifetime, but in the world history, and they all end. Vaccine or not vaccine, somehow there gets to be herd immunity, or the pathogen itself wanes in its virulence. But in this situation, we're going to be there probably late summer. Hopefully before that, but probably late summer. And let me just tell you what it looks like. There's 3 things people don't want to do, and they're going to stop doing them really quickly. And that's why we're going to keep pushing as long as we can. They don't want to wear masks. I don't want to wear a mask. They don't want to be alone. They want to gather with others. And then they want to travel. Those 3 things will return. If they return right today or soon after we vaccinate, it's going to be months of just real increasing death rates. So if we can get through into the beginning of the summer, when we get a good majority of the population vaccinated, then we'll be able to stop those. Certain things will continue, because remember, the disease is going to continue on, and people are still going to get it, just like they still get the flu, colds, pneumonia. We're still going to see it in the hospital. So it's likely that Marie and I are going to be wearing our masks and maybe even face shields for years in the hospital system. And it's likely that people are going to choose to wear masks when they travel. Those types of things will be in place for a longer period of time. But the normal that people want, those 3 things, being able to go over to someone's house for dinner, attend a concert, travel on vacation, those will be here in 2021 in the United States. Unfortunately, the world it's going to be longer in many places. It's going to take probably not these 2 vaccines, but some other vaccines that are in the works that don't require as much refrigeration,
Right.
which is a good thing. And I hope the United States will help, rather than being so focused on its own interest. I hope that it will be a part of the outreach to the world to help in this. Certainly, the medical community in the United States will do that. I'm hoping the government will as well.
Great, thank you. A question on Facebook. Does a person who tested positive for COVID still need a vaccine?
Yes, we are absolutely vaccinating people that have had COVID in the past, or this year, obviously. There are real variations of how much antibody a person that has been infected may have. And in fact, new data says that a person, especially if they've had a mild COVID infection, their antibody levels may drop quickly, and we're not sure if they're fully protected. So compared to vaccine, the amount of natural antibody you make is a real variety depending on the severity of your illness and your own health. So we're lumping everybody together, and including people who have had the illness, they will absolutely get vaccinated.
Great.
And they'll be an interesting group to study, of course.
Yeah, absolutely. A lot of things to study, including our history books after this. In the closing moments that we have together here today, I want to ask more of a broad question, kind of a future question for both of you. Again, if you're watching on Facebook Live, we have a couple minutes left. If you do have a question that you didn't hear answered today, please leave it in the next couple of minutes and we'll try and get to it. But for both of you, are pandemics going to become more common? I think is one of the big questions we've been kind of hearing. And kind of the other end of that, what are things we should do to prepare for maybe more common? Are we all keeping our masks either as keepsakes, or do we have to bring them out of the closet, in 5 to 10 years again to wear? So where are we at in terms of, is this going to become more common? And then what are some preparation things that we could all be doing?
Well, okay, I'll start, I guess. I think that we really should come out of this pandemic with a lot of lessons, so that we as individuals and governments and countries and the world, learn from what we've gone through. So if we just went back to business as usual, that would be a shame, and not the right legacy to the people that have lost their lives to this pandemic. Do we have the potential to have more pandemics? Yes, because there is more cross-country and international travel. There is more stress on our food chain that mixes, animals and people that may have, jumping what we call zoonoses to people, and which may have happened this time. There is, there's more potential for pandemics, I suppose is the word to say, but I would like to think that we will come out of this with lessons learned that will put into place things that will help us, resist that. In a personal level, yes, keep your mask, wash your hands, understand how viruses are so easily transmitted. And then in the next levels of our, both science and countries, I think we will, take forward and try to keep us, those preventative measures in place.
Yeah,
Dr. Dobson, any thought around that?
Well, Marie's exactly right. I mean, all of those reasons, we are going to see more pandemics. Still, although pandemics is hard to say, are we going to see more? Because we're talking about over time. So if we saw 2 or 3, that would be way more than what the average generation sees, which is about 1 to 0, 0 to 1. Some of those changes she's talking about, if we think about the last big pandemic, which was influenza in 1918, the average person in the United States traveled 40 miles from their home annually. It is very different today. I would be hard pressed to imagine what that number might be, but it's likely thousands, even including everyone, but it's certainly hundreds. So it shows that mixing that she was talking about is going to become more common and more common. And as a matter of fact, it's a cat and mouse game. So we'll work hard on the science, but then the virus itself and other viruses will work hard to beat us.
Yeah, absolutely. In the final moments, I just want to provide you, Dr. Dobson or Dr. George, any final thoughts as we exit into a weekend and hopefully a great holiday season, maybe a little bit more remote and whatever, but I think we're all heading into the holiday season a little bit with our spirits lifted. Anything you want to add before we close?
Go ahead, Marie.
Well, I guess I just want to say that we are, being careful, being, a Vermonter has really worked out well for us. Every single day, my family and my colleagues and my patients hear me say, we've done a good job, let's keep it up. And, we are afraid right now. There has been an uptick since Thanksgiving. So it's a lesson learned again. We can't just ignore what we're experiencing, and it could definitely get much worse after Christmas. And we're right on the cusp. So I'd like to encourage everybody to stay strong and follow the governor's guidance, the health department's guidance. They've been really so excellent, and we will hopefully have vaccines soon.
I'll say 2 quick things echoing that. The first is just use this Christmas, just be with your immediate family and plan something for the summer or fall. And just use that as what we're going for. It'll be much safer. The second is the next thing that's going to happen is there's going to be a lot of concern and back and forth and infighting about whether or not vaccine is safe. And so we're here to tell you it's very safe. please don't fall for the conspiracy theories. It is so interesting to listen to offbeat theories, but they don't materialize. The reason they don't materialize is because they're not real. And I tell you what is real, and that is COVID-19. And COVID-19 kills. It keeps people out of school. I said this earlier. So we need to get vaccinated. It's a much safer route, and that's what's going to get us to back to what you were saying earlier, Matt, which is a sense of travel, a sense of gathering, and a sense of getting rid of these darn masks.
Great. We do have a couple questions that got stuck in late, so we've got a speed round too, and then we'll kind of call it to a close. COPD, there's kind of two questions here. Has asthma, COPD, and blood thinners, I would assume that is kind of a phase 1 person, just clarification around that. And the other end of that question is they live in Hoosick Falls. And I've heard that often of, the fact that we're a border kind of hospital, are you able to service people in New York and Massachusetts as well? I know you also have clinics there, but can they come over to Vermont?
Marie, you take question 1, I'll take question 2. How's that?
Okay, well, yes, people with underlying lung disease like COPD, if you're using a blood thinner because you have an underlying heart dysfunction or, those people, yes, will be prioritized. They certainly will be, included in the phase 1 or phase 2. There's going to be strong, consideration for people's underlying health problems. And then go ahead, Trey.
Yeah, on the second part, the Department of Health is doing an excellent job, and I just want to give them so much credit. They're working just like everyone here nonstop. And they pointed out, they know that many non-Vermonters get their health care in Vermont. They know that many Vermonters work in other states, and they would like us to, treat each other the same. We're not going to be asking state residents. What we are doing is focusing on having enough vaccine for our population. And our population are the communities we serve, and some of those are actually across the border, like in Hoosick Falls, Williamstown, up in the northern part of Plattsburgh and so forth.
Great. Final question here around obesity, being such being a pandemic as well in the United States. Is that more at risk? And in that case, do obese people get put into a phase 1 or phase 2 if they have no other symptoms?
Well, all this work is being done. Yes, obesity is a risk factor for more severe illness. So that's why we're going to be partnering with all the healthcare givers in the community to identify people. Trey and I say this a lot, that we're hoping for wonderful supplies of vaccines so that we're not splitting, and counting out tiny numbers, that we're, that the feds and the state have really created a pipeline, and the companies have created a pipeline so that we're going to get a lot of vaccine. So I think, we're just being optimistic that, it's going to not be so much of a separation of people, but bringing everybody in.
Okay, great. Well, with that, I know we'll work with the hospital and CAT TV to do more updates as we get more updates. But on behalf of a grateful community and a state and even a country, I can't say enough. And I know there are many people commenting on Facebook right now about just the year you all have had, and obviously the nurses and doctors that work under you as your team. Just on behalf of Bennington and the Southwestern Vermont, we are so grateful to have you two leading the team, and thank you this holiday season.
Well, thank you. It's a monumental effort by many staff, not only in the hospital, but outside the hospital and in the community.
Yeah, great. Thank you. We like having this forum so we can talk to the community. Thanks.
Absolutely. So on behalf of Southwestern Vermont Medical Center, and I want to thank Dr. Dobson and Dr. George for joining us today. We will do more of these as we get more information. But on behalf of CAT TV and the Southwestern Vermont Chamber of Commerce, I want to thank you all for tuning in today. Have a great weekend and have a very, very happy holiday this season. Thank you.
Thank you.